Aloha. The 14-day quarantine requirement for all incoming visitors is intended to keep individuals from inadvertently introducing the virus to our community. That includes, of course, visitors and returning residents. We actually have more people coming back from trips, residents bringing the virus with them than we do visitors. So it's important that this apply uniformly. We continue to work very aggressively on identifying cases, quarantining those individuals or isolating them if they're ill, and of course contacts of those cases. We've been doing that since day one, and we continue to do that today. Today, the Department of Health is reporting 6 positive cases, test results from private physicians, which brings the total number of individuals diagnosed as positive for COVID-19 to 95. 4 of the new positive results were for residents on Oahu, and 1 was a visitor on Kauai. At this time, there have been no deaths in Hawaii attributed to COVID-19. On Monday, we reported late in the evening what we thought was our first death that was associated with this. This was an elderly individual who had underlying health conditions who actually passed away several days earlier. He had been tested by a private laboratory. The sample was sent to us and tested and found to be negative. Unfortunately, in the handling of the information as it went through our department, there was a mistake made and the test was recorded as positive. We retested the individual again just to be sure that it was negative, and yesterday the result came back as negative. So I'm very pleased that we haven't had any deaths in Hawaii, and I regret the error, which may have caused some anxiety and among family members and others, and I certainly apologize for that mistake. Nevertheless, I do think it's important we get information out quickly. We can expect that we may make mistakes from time to time, but under these circumstances, I think it's important that everyone be notified as quickly as possible when these sorts of things occur. As I mentioned, we had 6 cases today. We are still investigating many of those, and we are expecting to get even more information on those, but they all have a travel history or have been exposed to someone who has traveled, which is typically the case. We haven't seen any evidence of widespread community transmission. Today, we've received samples of over 4,200 tests completed to date by clinical laboratories. We've also now tested 370 individuals who, through our own state laboratory, many of those tests were done to determine whether or not there is community transmission. And I'm pleased to report that we haven't seen any positive cases among those that we've tested for that purpose. The top positives we are seeing are people who are going to see their physicians, who are identifying this as a potential case and having those results, having those tests done. And of course, we then are notified when that happens. The physicians in this state are our front line, and we support them entirely as they go through this process. I wanted just to emphasize that individuals who are not experiencing symptoms do not need to go see their physician. But if you are and concerned, you should see your physician. You should always see your physician before you obtain a test. That way the physician appropriately orders the test and can advise you when the test results come back. Whether it's COVID-19, the flu, or whatever it might be, you need to work through your physicians. So that's an important point. This morning I was listening to a telecast from our Surgeon General of the United States, and he offered some good advice, I think, to all of us, and that was to treat the situation as though you were infected with COVID-19 and do what you would do if you were infected. Distance yourself from your friends. Be sure that you're not violating that social distancing aspect of the disease that's so critical in preventing its spread. We can do what we can to retard the introduction of the disease through these aggressive measures that we're taking, but ultimately it's going to be how we interact with each other and keeping that social distance as to how effective we are in reducing the spread of the disease here in Hawaii. So take the recommendation seriously. Don't think this is something you should be taking seriously. You should all take it very seriously. If you have any doubt about that, you need to watch what's happening in New York. But thank you very much, and we'll keep reporting these daily basis, these numbers that we give to you. Thank you.